Ma'am, you can start.
Yes, Jai Hind and greetings to all dignitaries, resource person, all nursing professional and dear participant. We welcome you on behalf of any Uttar Pradesh chapter. Myself, Dr. Geeta Parwanda, as any UP chapter president and working as Dean Faculty of Nursing, Swami Vivekanand Subharti University, Meerut. Welcome you all on this webinar on theme establishing a patient safety transfusion safety goal 10 on the occasion of World AIDS Day. As you all know, dear participant, that the theme of World AIDS Day is Take the Right Path, My Health, My Right. And the main objective of this webinar is to sensitize all the nursing professional to achieve maximum possible reduction in avoidable harm due to unsafe healthcare, globally envisioning a world in which no one is harmed in healthcare and every patient receives safe and respectful care every time, everywhere. Today, the discussion will enhance the knowledge and skill in training and the experience related to the knowledge of safe blood transfusion practices and how to reduce the error. Those strategies will be discussed by our renowned nursing educators, nursing practitioner, and we welcome Professor Anand Pereira, who is having a enriched experience and he is working at present in regional hospital as a graduate nurse, Sydney, Canada. He will be discussing about that how globally and in an Indian setting we can be more responsible in practicing the safe transfusion practices. In this webinar, we have another renowned person who is a UP chapter ANI member, Mr. Hariharan, who is working as a associate vice president in Regency Hospital, Kanpur. I welcome you, sir, and he will be discussing regarding on the theme of World AIDS Day that how we can achieve the practices regarding choosing the right path on my health and that is my right. I have another speaker with me, Professor Infantrani, who is a ANI member and working as vice principal in Government Nursing College, Firozabad, and she will be discussing on the midwifery health, how we can achieve by fulfilling the aim of safe blood transfusion practices. So I hope that this discussion, this session will take out the positive outcome, and I appreciate the team members of our ANI UP chapter, and I am thankful to our ANI National President Captain Ajita and the founder president Mrs. Tankam Gomez for all their support and guidance time to time. Jai Hind and thank you. And I hand over the today's session as a coordinator to Professor Amli Venu. Please.
Thank you, ma'am. Uh, so let's begin the session. Coming together is a beginning, keeping together is a progress, working together is a success. By Henry Ford. Let's open our mind and hearts to new ideas as we come together to learn new facts and share knowledge. With this beautiful quote, I wish honorable members of any members and esteemed speakers, learned delegates, respected teachers and students, a very good morning to one and all. It is on the occasion like this we get opportunity to test our knowledge and understanding. Hope this webinar truly inspires, influences, and motivates us to work hard in order to bring most dynamic changes in our profession. This is a great opportunity for all of us who gathered here to make the most valuable lessons. I want to thank the Association members and leaders, especially President Captain Ajita ma'am and National Vice President Dr. Unmuna ma'am and Tangang Gomez ma'am, who has given the permission to organize this event generously, donated their time and expertise to make the webinar a reality. A special warm welcome to all the extended speakers joining us today. We appreciate your willingness to share your knowledge and expertise, and I'm confident that everyone here will gain something from your profession. Then today, the webinar is important for all of us as it will provide us more valuable insights and information on the topics that is essential to our education and future careers. The theme of the webinar is Patient Safety Goal 10 in relation to the World AIDS Day. And we have gathered some of the most knowledgeable and experienced professionals in the field to speak to us today. We are all aware of the importance of World AIDS Day theme and the patient safety in our lives. Whether we are studying it in our class or planning to pursue a career in this field, understanding these subjects is crucial for our success. The speakers today have been handpicked to provide us the most up to date and relevant information on this topic. I know that we all benefit significantly from their presentation. In conclusion, I would like to thank all of you for being here today, and I hope that you will make the most of the opportunities to learn and grow. I am excited to hear the presentations and participate in the interactive sessions, and I look forward to the discussion and connections that will be made. If any queries or questions, you can put in the chat box for further discussion after the sessions. So let us start with the session. So I hereby handing over to Assistant Professor Lindsay Abraham for the brief introduction of the speakers and thereby continuing the session. Thank you.
Good morning. We'll have a first speaker. Uh, we have among us Mr. Hariharan Shankarraj sir. Sir is a scholastic. He's from IIM Business Management from Bangalore. He is a PhD scholar from TMU. He has done his Indian Diploma in Critical Care Nursing from Mumbai. He is a postgraduate diploma hold in hospital management from Annamalai University and MSc Nursing in MSN from Rajiv Gandhi University. The career objectives or career overview of Sir is he's presently working as an Associate Vice President Nursing at Regency Hospital Limited, Kanpur. He has worked as Senior Manager in Nursing Services in Max Hospital, Saket, New Delhi. He's the Chief of Nursing Services in Columbia Asia Hospital, Ghaziabad, Senior Manager in Nayati Healthcare, and the Deputy Nursing Superintendent in Max Specialty, Super Specialty Hospital. I welcome you, sir, for the session.
Good morning, everyone. Thank you so much for that introduction. First of all, I thank Prof. Dr. Geeta, Dr. Geeta ma'am, and giving this opportunity as a speaker on this webinar. And I take through my session. I got a call for saying that we wanted to take you on board as a speaker. I said okay. So they asked for the topic, then I said okay. So topic was that on the theme. So theme, yes, I said okay, theme is okay. But on the 2nd of December in the morning, when I saw the Times of India, Times Newsweek, so we got a current information. So my information, the knowledge, information, what I'm going to share today, it is always going to be just hardly 5 days before information. So it is the current information, current statistics, and current availability of all the information and knowledge which I'm going to do now. Yes, I think you can go with the presentation now. Thank you so much for my introduction that you have given. Yes, we have almost six hospitals and other few subsidiaries institutions we have in Regency. So we have a group of hospitals. Okay, I'll take you through the presentation. I'm just going to take through the last slide. I start from the last slide. So this is the reference basically. This is the paper cut. This is the one which is published. This is the information which I have seen in the newspaper, and based on the presentation is made based on this particular information what we have got through. Okay, okay. So basically, the theme of International World AIDS Day 2024 is just a minute. I'm taking through that. Yeah. So theme is take the right path. My health is my right. The mission of this team is basically empowering the individuals to claim their health as the fundamental rights and combating stigma associated with HIV and AIDS. Okay. The importance of this theme is basically intersection of the human rights and healthcare, advocating for inclusiveness and stigma-free healthcare system. And also it inspires the individual living with HIV to prioritize their health and encourage society to contribute towards to global AIDS prevention and treatment goal. I think some of the points are not visible. I could not see that. Yeah. Global implementation of the theme. There are three focused area. What they have focused is inclusivity, empowerment, and healthcare access. In inclusiveness, they have to promote stigma-free environments for individual affected HIV or AIDS, and also encouraging community participation and voice in policy making. And empowerment can be done through people about their health rights, educating them, and strengthening the advocacy for equitable healthcare access and human rights. Healthcare access is by expanding access to affordable treatment for everyone and preventing the services of them. Addressing the gaps in the healthcare infrastructures for underserved population. Global implementation of the theme. Basically, theme has certain strategies to include partnerships, awareness campaigns, and policy reforms. Let's see about all that. Policy reforms is basically advocating for legal frameworks that protect health rights. Awareness campaign is basically raising awareness through media, community events, and educational programs. Partnership is collaborating with governments, like there are many governments, state government, central government, NACO, etc., NGOs, and also global health organization like UN for AIDS, WHO, to achieve inclusivity and accessibility. And these strategies and actions also has a key point. There are five key points based on the information what we have got in there. Universal healthcare access, an awareness campaign, community empowerment, focus on key population, and global regional goals. Universal healthcare access is basically United Nations for AIDS and WHO work with governments to provide accessible HIV treatments like TLD. There's something which is important here is TLD. TLD is the regiment of model of medicines which has been replaced TLE. I'll explain in more in detail in following slides. And key focus area is here to give a free and affordable ART program, antiretroviral therapy program for underserved populations. Awareness campaign is basically it's promote rights-based health approaches to reduce HIV and AIDS stigma. Stigma is something is always the negative thoughts, feeling, thinking, experience. It's all about that. It's stigma which is negatively perceiving and all that. So that to be reduced actually. By that can be done in the schools, community, online programs, emphasizing prevention and testing and early treatment. Community empowerment is basically grassroots workshops in community and support groups, in smaller groups, and empowering individuals living with HIV. Advocacy is very important here because the legal aid for discrimination cases and equal access for education and employment. Focusing on the key populations, women and girls, addressing gender inequality in the healthcare, and this is something which is a transgender and LGBTQ. This is the things that you have to go and look for that to understand this. Lesbian, gays, and bisexual and transgender communities and all inclusive services to tackle the barrier. And youth has to get in through the preventive education and stigma-free treatment access. The global and regional goals are like 2030. The agenda has been set that to eliminate HIV and AIDS as a public health threat and reduce new infection by 30%. Actually, the first 2-3 slides which I could not show you because of there are data which supposed to show you, but it is not visibly available. But however, I will tell you the data later on. Reduce the new infection by 90%. 95% of the individuals living with HIV to know their status. Most of them, they don't know that still they are infected or not. Regional focus, integration of the HIV care into general healthcare system in South and Southeast Asia. Advancement in HIV treatment. This is what I would said that earlier. TLD regimen and increased coverage. The TLD is tenofovir, lamivudine, dolutegravir. These are the three medicine regimen, which is the new era in HIV treatment. HIV treatment, this is the new, this is the latest. Expert has been confirmed that this is giving much improvement, much clinical outcome, and very, very minimal side effects than the other drugs. There are 18 lakh people under treatment. And every year there are 3 lakh people in every 5 years adding up with that. So demographically, if we speak about, there are 8.1 lakh men, there are 7.4 lakh women, transgender 653 as on current state. Suppose the global goal to end HIV and AIDS by 2030. There are a few slides I could not see that. So basically, India's efforts for 2024 HIV global is key initiative by NACO. NACO is its control organization nationally. So integration of TLD regimen into national HIV treatment plan. Main initiative of this NACO is basically this. A widespread of testing. Testing is very important in counseling campaigns and focusing on rural areas. Rural areas and remote areas are supposed to be more focused on that. Awareness of the campaign, community gathering, cultural programs, social medias, campaigns to combat the stigma, to create more awareness on that. And the educational drives to be taken care in schools and workplace and prevention and early treatment. Focus on vulnerable groups, that inclusive programs for women, transgender individual and other at risk populations. And empowerment to be give exercise to healthcare rights. Challenges to overcome is 3 things. Social stigma is one of the biggest problem. There are so much bias, partiality, favors and effects and all that against people living with HIV, especially in conservative regions. Okay, and healthcare access, there is very limited infrastructures in rural area and remote areas basically. And one of the biggest problem is again is the funding. Need for sustained investment and scaling up the programs. There should be a good amount of fund to taking care the sustained investment on that and to scale up more programs which make more impact on that basically. And the vision is basically achieving equitable access to HIV prevention, treatment and awareness by 2024. This is what the vision of this. Yeah, team and NACO initiative is basically right based to focus on healthcare, tackles HIV and systems inequalities and ensure inclusivity in the fight against HIV. Basically, there are intervention which has been targeted. This is what the impact of 2024 theme, which targeted intervention is basically program for female sex worker, men who have sex with men, and people who has with injectable drugs and transgender community. And also the targeted interventions are contraceptives and other thing, and clean needles and opioids, substitution therapies, and also counseling. And ART centers also developed, that's called Link ART Center, antiretroviral therapy centers, that's called Link LAC, LAC. Access to ART in underserved area. Underserved area is very limited served area, limitedly accessible areas. Reducing burden on urban clinics. Okay. And parent to child transmission prevention is also has taken care HIV testing for pregnant women, ART for mothers to achieve zero transmission. And there is something which is important that I want to tell you, that Red Ribbon Express is the train. Train has initiated as about many years before. The train has almost covered 17,000 kilometers in India by giving HIV/AIDS awareness. There's a train campaign. Basically, it provides education, testing, and counseling. It almost done more than 10 million people coverage on that, and it's traveled almost to 23 states in the country. Basically, this is what the Red Ribbon Express. This is initiative by the government of India that has been since many years. It's happening. So youth engagement is a Red Ribbon clubs in schools and colleges and promotes HIV and AIDS education and prevention. India has partnership towards to the key partnerships in terms of global collaborations, and also United Nations for AIDS also has on the goal Sustainable Development Goal 3, good health and well-being. That's what their goal, SDG goal number 3. Basically, the global fund supports HIV prevention, ART services, and diagnostics. WHO who provides technical support for ART, guidelines, and healthcare worker capacity building. So basically, they support for the resource, they support for the guidelines, they support training and all that. Who does it? WHO does it, all that. Bilateral partnership is both collaboration with countries like US, PEPFAR, that is Presidential Emergency Plan Fund Antiviral Retrotherapy, basically. So for the research and funding, okay. And global partnership and innovations is by United Nations AIDS, that is 95, 95, 95, ensure 95% of person living with HIV, people living with HIV, okay, of they know that their status, and they are aware of their ART therapy and achieve the viral suppressions basically. And global innovation like long-acting injectables, vaccines, and that cure, and also in research. Equity and human rights, the programs focusing on marginalized group. It's a small group. It's a divided in small group, marginalized group. It's a fixed kind of a group, and right-based healthcare access. So collaboration for affordable ART regimen as well. And the future direction, as per the article what I have gone through, the future direction is has been mentioned in 2 dimensions. So that is globally and India. So when globally it comes sustain fund for the investment and for the program, and to reduce HIV and AIDS. Basically, this is what that. And then also integrative healthcare, HIV care with universal healthcare initiative. This is the two which is globally the future direction has been given. As far as concern of India, strengthening the rural healthcare system, and also combat the stigma through policy and education. So this is what the future direction for India as well as the global. This is the reference. Yeah, I think I have done my presentation, and I would like to give you some take home message that you can go and you yourself can search it. You can write it down if you want to write it down, like stigma, TLE regimen, marginalized group, NGOs, United Nations for AIDS, ART program, curb goals, induce opioid, ART centers, linked ART centers, okay, antiretroviral therapy, and Red Ribbon Express, Sustainable Development Goals, and Presidential Emergency, you know, and Plan Fund for AIDS relief. So these are the keywords that you can go and you can search. You can get all more knowledge on climate information. Okay.
Thank you so much, sir, for a wonderful session. So no question has been put on with the audience, I guess. Any question is there, you can put in the chat box regarding the session. Any questions from the audience? It can be put in the chat box. So there is one question from my side,
Yeah.
just to know. Sir, you have given a very good explanation regarding the theme which has been put on this year for the World AIDS Day, and an estimation that we can actually have a solution for your HIV preventive aspect also till 2030. So,
That is
sir, how much?
2030.
Yes, sir. So how much do you think it will, like with all the things which has been focused on, how much percentage do you think it can?
Percentage. As I
Yes.
mentioned, there are three important components what they are focusing.
Yes.
One, the people should know, that is
Yes.
92%. People should aware of their health status, that is also there. So as of now, as 2030 agenda, that is 95, 95, 95, what they have set target for 2030. But it is really challengeable to reach
Yes.
until and unless that the future direction has been addressed by globally as well as in the Indian subcontinent
Yes.
and South Asia concerned. And yes, and Indian subcontinent is one of the vulnerable geographic area if we talk about globally, and as well as the number of cases and number of incidences happens, it is also in the Indian subcontinent. So it is very difficult to achieve, but yes, as far as data says that it could be possible somewhere about 86 to 88%.
Thank you, sir. Next. So we are moving on to our next session. We have our speaker. Professor Anand Sam Pereira, sir. Sir is a PhD scholar. He has pursued MSc in medical and surgical nursing, has completed his MBA in hospital management and BSc nursing. He is a member of Alumni Association in Coimbatore, the TNAI, the ANI, and Society of Indian Neuro Nurses. Sir has attended as well as organized many workshops, seminars, and webinars as well. So has been resource person and speakers for many webinars and workshops, and has also done community service trainings as well. Sir is having 14 journal publications and 3 academic projects. Sir has achieved first place in group academic excellence also. He has been awarded the Young Professor of the Year, Education Excellence Awards in 2021. We welcome you for this session, sir, and you can continue. Thank you.
Good morning, everyone. Can you hear me?
Yes, yes, sir.
Yeah, good morning, everyone. And it's midnight 1:30 here in Canada, so it's night for me. And first of all, I thank our principal, Dr. Geeta Paramanda ma'am, for giving this opportunity to be a speaker on this day. So I'm so grateful to her and also the organizers. And I wish everybody, the faculty members and the students, those who put the effort in conducting this webinar. Okay, let me start my session. As it's,
So your PPT.
yeah, let me share my PPT. Can you see?
Yes, sir.
Is it visible?
Yes, yes, sir, visible.
Okay, okay, fine. So today's topic I'm going to present on zero harm, the workforce safety and well-being. It's a general topic. So how we can prevent harm and how we can eliminate harm. Actually, it's a zero harm. So from our workforce and the safety and well-being. So in this zero harm, I'm going to speak about the strategies for creating a safe and supportive environment. This is the major topic that I'm concentrating on this. So how to create a safe and supportive environment. So before that, as introduction, let me see what is zero harm. It is the concept of eliminating all preventable harm to patients and healthcare workers. It's about creating an environment where safety is paramount and no one gets injured or suffers unnecessary complications from uh, healthcare activities. So that is the major concept. So eliminating the all preventable harm to patients and healthcare workers. And we are creating an environment of safety. That is zero harm. As we said here, as we have said, seen here that the concept of eliminating all preventable harm, it focuses on identifying and addressing all potential risk that could lead to harm. So the what are the factors that involves in identifying and addressing all this risk? The first one is proactive measures. So what do you mean by that? Proactive measures. It is just implementing safety protocols and the preventive measures to avoid the incidents before they occur. So we are preventing it before they occur. That is proactive measures. And the second is continuous improvement. Even though we implement the safety protocols, we are regularly evaluating and refining practices to enhance safety. So that is the continuous improvement. And the third is culture of safety. So, culture of safety is promoting an environment where safety is the shared responsibility of everyone in the organization. It's not only the nurse's role, that whoever works in an hospital organization, everybody's responsibility in order to maintain the culture of safety. So, these are the three factors that that focus on identifying and addressing all these potential risks. And if you see the importance in healthcare settings, so what are the importance in healthcare settings regarding this preventable, that is zero harm? So one is patient safety. That is very very important. We are in the webinar that we speak a lot about patient safety. That is very very important in health settings. So ensuring that the patients receive care without experiencing preventable injuries or errors, that by improving the health outcomes, that is patient safety. And second is workforce well-being. So workforce well-being is uh, we should take care of ourselves. Nurses, we should take care of ourselves. Then only we can provide proper care to the patient. So protecting the healthcare workers from injuries, infections, and burnout. So that supports their ability to provide high quality care for the patients. And the third is operational efficiency. So the efficient in reducing the incidence of adverse events that can lead to fewer complications. That means shorter hospital stays or lower healthcare costs. So this is the operational efficiency. And the last one in the importance in healthcare settings is trust and reputation. That is very, very important. When we are when the patients is when the patients are not trusting on us, when we are not giving proper care, they won't trust on us. And there is no matter that what care we give, if you are not providing a proper care for the patients. So we have to build the trust of the patients. So a strong safety record that builds trust with the patients and enhances the reputations of healthcare institutions. So this is the importance of the zero harm in healthcare settings. So now we'll go one by one the details of what we have listed in the zero harm. The first one is importance of workforce safety and well-being. So this importance of workforce safety and well-being we are concentrating on two. That is, first one is impact on patient care, and second is staff retention and morale. That is very, very important because there are lots of nurses today in from India, many of them moving out from India, going to UK, Ireland, Canada, Australia, all over the world. So there is lack of staff nurses. So how we can return the staff? So that is very, very important. So importance of workforce safety and well-being, where we are focusing on two: impact on patient care, and the second one is staff retention and morale. When you see on impact on patient care, correlation between staff well-being and patient outcomes. So if we are monitoring, or if we are focusing on staff well-being, automatically the patient outcomes will be good. So in when you see some factors that how the factors that relate between the staff well-being and the patient outcomes, and if you see in staff retention and morale, the importance of a safe work environment for retaining staff. So this is very, very important, how we can retain staff by providing a safe work environment. So when you see in correlation between staff well-being and patient outcomes, we have three: quality of care, attention and focus, empathy and compassion. So, quality of care: nurses who feel supported and valued are more likely to provide higher quality care. If your core staff, they work properly, if you tap them, they are doing good, and if you encourage them, if you value their work, automatically they will be boosted, and they are more likely to provide higher quality care when you support them. So this leads to better patient outcomes, fewer errors, and higher patient satisfaction. And second is attention focus. Well rested and mentally healthy nurses can focus better, make more accurate clinical decisions, and respond more effectively to patient needs. And third is empathy and compassion. As we say, empathy and compassion, nurses are empathetic and they are compassionate towards everybody. Same, nurses who are not overburdened by stress and fatigue can be more empathetic and compassionate, improving patient experiences and fostering a therapeutic nurse patient relationship. So, these three factors are very, very important uh, in maintaining the correlation between the staff well being and the patient outcomes. And when you move to the staff retention and morale, where the safe work environment for retaining staff, it is important as reduced turnover, job satisfaction, professional growth, and cost savings. So reduced turnover, a safe and supportive work environment that reduce the burnout and job dissatisfaction that leads to lower turnout rates. So this helps to maintain a stable and experienced nursing workforce. And automatically job satisfaction, if you are healthy, or if you are if healthy and safety are prioritized for the nurses, they are more satisfied with the jobs. So this enhances their commitment to the organization as well as their role. And professional growth, that everybody seeks that. Each and everybody seek that we should grow in our profession. So safe work environments encourages continuous professional development and growth, which in turn boosts morale and engagement. And cost savings, high turnover can be costly for healthcare organizations due to recruitment, training, and lost productivity. So, retaining staff through a safe work environment can lead to significant cost savings. So, when we meet all these the factors, automatically there will be staff retention. So, creating a safe and supportive environment for nurses not only improves their well being, but also positively impacts patient care and organizational efficiency. So, a focus on these areas is crucial for achieving zero harm and fostering a thriving healthcare workforce. And if we move to the next, is automatically common risks and hazards in nursing. So there are three types of hazards. What I'm mentioning here, the first one is physical hazards. So physical hazards mainly, we lift nurses, we lift uh, patients, we move patients, or we reposition the patients, we transfer, we lift. So this might cause musculoskeletal injuries for the nurses. So the nurses frequently perform physically demanding tasks such as lifting, transferring, and repositioning patients, which can lead to musculoskeletal injuries. So, how we can prevent this? Implementing proper lifting techniques, using assistive devices like transfer belts, and ensuring adequate staff level to share the physical loads. That's how we can limit, or we can prevent the musculoskeletal injuries. And if we move to exposure to infectious diseases, nurses are at risk of exposure to infectious diseases. Everybody, all the nurses might have come across during COVID pandemic situations. So we are more prone to be affected by this infectious diseases. So we should follow strict infectious control protocols, including the use of PPE, hand hygiene practices, and proper disposal of sharps and other contaminated items. Even we know about the prevention of AIDS. So it is very important that proper disposal of sharps and other contaminated items. And second is emotional and mental health. So automatically it is not for all, not only nurses in any field. It's very, very important, the emotional and mental health. So stress and burnout, the high pressure and emotionally demanding environment in healthcare can lead to chronic stress and burnout among nurses. So how we can prevent? Providing access to mental health resources, promoting a healthy work-life balance through flexible scheduling, right? Flexible scheduling and adequate rest breaks, and fostering a supportive work culture. The next is compassion fatigue. So automatically, we are nurses, or when you expand nurse, where S sympathy and E is empathy. So continuous exposure to patient suffering and the demands of caregiving can result in compassion fatigue, when nurses become emotionally exhausted and detached because of these sufferings. So always offer counseling services, establishing peer support groups, and encouraging regular self-care practices. And the third is the chemical hazards. So, nurses, we always handle various hazardous substances, including chemotherapy drugs, disinfectants, anesthetic gases, which can pose a significant health risk. So, providing proper training on the safe handling, storage, and disposal of hazardous substances using appropriate PPE and ensuring well ventilated work spaces. So, by addressing these common risks and hazards, healthcare organization can create safer and more supportive environments for nurses, ultimately leading to better outcomes for both staff and patients. And next is strategies for ensuring physical safety. This is very very important because everybody speak about patient safety. What is about our safety, our nurses' safety? So that is ergonic solutions. So ergonic solutions. So ergonic is a scientific discipline mostly concerned with the understanding of the interaction among a human and the other elements of a system. So we work in the unit. We handle with the cot, we handle with the chair, we handle with the other systems that helps in patient care. So you can see the picture, that examples of patient handling ergonomic technology solutions. So whichever comes in relationship, in interactions with the humans and the other elements of the system carrying patients. So that is ergonic. So here we have proper lifting techniques. So always teach and practice safe lifting techniques that will help to prevent our musculoskeletal injuries. So you know how to do all this work. So always bend at the knees, not at the waist. Keep your load close to your body to reduce strain. Use your legs to lift, not your back. So these are the important points you should note while doing all these activities. So how we can have these proper lifting techniques? Sometimes we lack in that. So automatically, regular training sessions and refresher courses regarding this can be held for the nurses. And use of assistive devices, that can reduce strain on nurses. So ensure that assistive devices are readily available and maintain in good working order, and conduct training sessions on their proper use. And the second is infection control measures. Automatically, we know, if we are nurses, we are more particular in that, and we are more popular in that, using proper use of PPE and the hand hygiene protocols. So there is no self-explanatory that if we all nurses know about the proper use of PPE and hand hygiene protocols. And next is promoting mental health and well-being. So that is very, very important in today's scenario. So first one is mental health support, and second is work-life balance. So how this mental health support? Automatically by counseling services and by peer support programs. So we know that counseling services, that we provide access to professional counseling services that can help the nurse to manage their stress, anxiety, and other mental health issues. So normally, it's very important in all the working place that we should have counseling services. Counseling is just getting relaxed and taking out of stress. It's not that, oh, if you go to counseling sessions, we think that we are not mentally fit. No, that is wrong. It is a refreshment for you, for your mind. So always counseling services is very very important, and also peer support groups, that is very very important, because when you create a network of colleagues, so that will help your emotional and practical support to each and everyone. And when you go to work life balance, flexible scheduling, that is important. Flexible scheduling. So you can offer flexible work schedules that can help nurses to balance their professional and personal lives, reducing their stress and burnout. And also the adequate rest breaks. So ensuring that nurses have sufficient rest breaks during their shifts helps them recharge and maintain their mental and physical well-being. Maybe if you in Canada we have 12 hours our clinical session. So every 4 hour we have a break. So every 4 hour we have break, 1 hour break. So we take 1 hour break, we rest, we have our free time, then we come back to work. Then after 4 hours again we go for break. So we need adequate rest breaks during our shift too, so that will help to regain our strength and refresh our mind, and we provide proper care to the patients. So that is promoting mental health and well-being is very important. And then creating a culture of safety. How we can create a culture of safety here? The first one is leadership commitment. There are many leaders who are watching here, even teachers. We are taking the position of leadership. So you should be an example for others, just not commanding them. The leaders should go in front and lead them and do the work. So automatically the followers or the other workers, they put trust on the leader and they work on that. So leadership plays a crucial role in establishing and uh, maintaining a culture of safety within the healthcare organization. So how it's a visible commitment. That is, leaders must visibly support and prioritize safety through their actions and decisions. And resource allocation, they should allocate sufficient resources for the training programs or for the funds. And also the policy development, developing and enforcing policies that promote safety practices and standards. So they always communicate, the leaders regularly, they should communicate the importance of safety that involve staff in safety discussion and model safe behaviors. And then safety training and education programs. So continuous education and training are fundamental to keep staff informed about the latest safety protocols and the practices. So conducting mandatory safety training sessions for all the stuff, you should make it a compulsory. So compulsory when you complete the training programs, and keep their training materials current to the latest guidelines and best practices. And also you can use simulation drills to prepare staff for the emergency situations and reinforce safety protocols. So always develop a comprehensive training program that includes initial training for new hires and ongoing education for all staff. So like that, we can have a staff development program or in-service education that helps to regain their knowledge. And second is reporting and addressing incidents. So in reporting and addressing incidents, the first one is encouraging report of safety incidents, whatever happens. So create an environment that let the staff, if any incidents happens, let them report, so they will not be punished, or there is no harm in that when you report to the higher authority. So you should create an environment for all the nurses, and providing feedback, offering feedback to staff on actions that's taken as a result of the reports, so that shows the concern towards the nurses. So establishing clear reporting channels, such as an online reporting system or a dedicated safety officer, and promote those options to all staff. So regularly review and act on reports to demonstrate commitment to the safety. And then implementing solutions to prevent recurrence. So even though we identify safety incidents, it's very essential to implement solutions to prevent similar issues from occurring again in the future. It should not occur again. So we should we should implement these solutions to prevent those issues. So always by conducting root cause analysis, and after that action plan and monitoring and evaluation. So by fostering a culture of safety, the healthcare organizations can protect their workforce, improve patient care, and achieve zero harm. So creating a supportive and proactive environment where safety is a shared responsibility can lead to a lasting positive outcomes. And we have challenges, right? Why? What are the challenges? Sometimes the common challenges is resistance to change. Suppose we are adapted to a particular procedures. When someone brings when the organization is trying to implement a new one, sometimes we resist to adapt that a new thing. So that is, so implementing new safety protocols and practices can often face resistance from staff accustomed to existing routines. So because what is the reason for that? Because they are comfort with current practices. Okay, let me be like this. Why I should, I'm on this on the stage of retirement, why I should learn new things? Let it be. So sometimes fear of increase, again I have to fill everything, and a new method will make my workload more. So fear of increased workload or lack of understanding about the new benefits. So that will make a resistance to accept the change. And when you say automatic resource limitations, maybe sometimes a small hospital, they might struggle to afford many things. So this limited financial, human, and material resources can hinder the implementation of safety initiatives. So maybe because of insufficient budgets, lack of adequate staffing, or lack of adequate facilities. So these are the resource limitations, that the challenges we are facing. How to overcome all these barriers? That is very important. How to overcome? So there are strategies for implementation: engage leadership, effective communication, involve staff in decision making, and provide training and support. So if you see engage leadership, strong leadership commitment is crucial for driving a change, because a leader should lead for the change. If the leader is not presenting anything, automatically the team will not accept the changes. So the leader should take a commitment in driving their change. So leaders should visibly support new initiatives and allocate necessary resources. And effective communication, clearly communicate the benefits of new safety measures to all staff. Use simple channels such as meetings, newsletters nowadays, WhatsApp. We have WhatsApp group. All the information we are receiving through the WhatsApp group. So through the easy channels, you can share the benefits of new safety measures, and engage nurses and other staff in planning and implementation of the process, in buying or reduce the resistance. So always include everybody. Seek uh, the help from each and every co-workers. That will help to develop the team spirit. And then provide training and support. Offer comprehensive training and ongoing support to help staff adapt to new protocols. That is very, very, so these are the strategies for implementation. And how, what are the importance of continuous improvement? So there is ongoing monitoring and evaluation, foster a culture of learning, and adapt and innovative. Even though we are implemented, but there should be ongoing monitoring and evaluation. If there is no teacher, students are free. If there is no boss, the workers are free. They will never work properly. So always we should monitor and evaluate. Even though you are implemented, you should monitor and evaluate. So regularly assess the effectiveness of safety initiatives through audits, feedbacks, and performance metrics. Use this data to make informed adjustment and improvements. And foster a culture of learning. Encourage a culture where continuous learning and improvement are valued. Celebrate successes, learn from mistakes, and share best practices. And always stay updated with the latest. That is very, very important. Read to all the student nurses, to all the nurses, read the journals. You'll get most latest research and innovation regarding the healthcare safety. Be open to adopting new technologies and practices that can enhance safety and well-being. By acknowledging and addressing all these common challenges, and by employing strategies that emphasize leadership, communication, and continuous improvement, healthcare organizations can effectively overcome barriers and move towards achieving zero harm. Our aim is achieve zero harm. So, to conclude, just we saw about promoting mental health, that is zero harm. Where zero harm, what is the concept is eliminate all preventable harm to patients and healthcare workers. So how to create a safety environment, and what are the strategies to ensure physical safety, and what are the challenges we are facing and how to overcome the barriers. So this is about the zero harm, what we have dealt.
Thank you so much, sir. There are some questions which have been asked in the chat box.
Okay.
So first is any blood transfusion safety protocol is there exclusively on HIV patients, which has been adopted as the policy guideline in any 100-bedded hospital?
Currently, I don't have, but when you there are many studies being. Let me check it. Yeah, there are many studies being done regarding these safety protocols. When you Google it with the same question what you have asked, there are many journals they have conducted the studies, so you'll get the proper the protocols, how to what are the safety protocols we have to do. That is the procedures wise it is uploaded, so you can have it.
So one more question is there. So, what patient factors might necessitate special considerations during a transfusion, and the challenges of a nurse which are being faced during transfusion and maintaining patient safety?
Okay, so as we said, as we have already discussed about the safety protocols in wearing PPE and the hand hygiene techniques, that is very, very important. So these are the protocols that is we should follow properly to these are the challenges what we have faced, so we should follow this properly to prevent from the infections.
So, Hari Haran sir wants to add on something, I
Yeah, yeah.
guess. So, please.
I'm audible.
Yes, 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 sir,
Yeah.
please.
For the safety guidelines practices, the patient who has HIV, right? Yes, in India we do have the Infusion Nurses Society, which is called INS, and it has the standardized guidelines for infusion therapy.
Yeah,
They have a standardized elements, guidelines,
yeah.
stand, all that, and they are also included such kind of patients. also which is included. So we do have standard guidelines. There are few hospitals also accredited Infuse. That's a name called Infuse. So they are at par excellence in infusion practices as far as concern of India, and that is also associated uh, things with US. US also there is INS. We have associated. So we do have a guideline, standardized, all that available, and hospitals are using and getting
Yes.
accreditation on that. So we do have.
Okay. Thank you so much, sir. Thank you, Anand sir, for your beautiful discussion regarding the zero harm. Indeed, the workforce should be healthy to provide a good quality care. So, thank you so much for your time.
Thank you.
We
Thank you. Convey.
Yeah, sure. So we'll move on to our third session of the third speaker. I'll introduce. We have among us Professor Infant Rani ma'am. She's the professor as well as the vice principal, College of Nursing in Firozabad. Ma'am has completed her education MSc Nursing. She's a PhD scholar from Swami Vivekanand Subharti University. A total experience of 15 years is there, both in teaching, including both teaching and clinical. And her various achievements are there. She has organized, attended, presented paper, and also have served as a resource person in more than 15 workshops nationally as well as internationally. Ma'am has completed simulation training by the INC and has organized 3 times simulation hands-on training. Ma'am has also published 20 papers in national, international, and Scopus journals. Ma'am has also reviewed more than 10 nursing research articles, also have presented many papers in national and international conference. She has also guided numerous projects and dissertation work of BSc, post-BSc, masters students. Then has been an editorial board member and reviewer of ACTA Scientific Medical Journal. 2 patents has been published and is also having the copyright certificate, and has published a book on microbiology for nursing and pharmacology for nursing students as per the INC syllabus, and is also having a lifetime membership of TNAI, ANI, and SOMI. We welcome you to this platform, ma'am. Kindly start with your session, ma'am. Thank
A warm good
you.
morning. Yes, I think I'm audible.
Yes, ma'am.
One second.
Can share your PPT also when you start, ma'am.
Yes, I'm sharing.
Yeah.
A warm good morning to all. It's very good. That means always God is good at all the time. I would like to thank Professor Dr. Geeta Parvanda ma'am for giving me such a good opportunity, being a resource person, especially on this topic, that is HIV Day week celebration, that is transfusion issues related talk. And also, when I saw Professor Anand sir, it's giving me a very happy moment, and also it's taking me back to the olden days. Thank you, sir. I think the previous speakers were given a very excellent speech on all the topics. So now, when we are moving into my topic, as we all know that it's HIV is it's not a not a curable, and also it we cannot after coming we cannot prevent or something. But when we are seeing in a pregnancy, during pregnancy or a intranatal or a postnatal period, at least we can reduce or minimize transfusion or a transmitting infection to mother to child. So I'm here to talk this topic on transmission and prevention of HIV during antenatal, intranatal, and postnatal period. So as I told you all, it's a already we have seen it's a not curable. It's a not a curable, and also we know that is all we know, that is the difference between the syndrome and symptom. When it is comes into the AIDS, it is a syndrome, and HIV is a symptom. We know that if you're seeing in a worldwide, as per the population, 25 to 30 percentage of infected patients are women, and especially that also during a 20 to 40 years during a fertility period. It can be like a antenatal, intranatal, or a postnatal period, more chances of transmitting infection. As I told you all know that the causative organism is like a double stranded RNA retrovirus, everything we know. But still, why we can't able to cure, or because we know that which has a like a double stranded RNA with the drug or nothing cannot penetrate this protein cells. That is why we are not able to cure it. And still, but we can control it. How we can control, that is the main focus I'm going to talk today. So when we are seeing in a HIV prevalence, we know that during 1980s it has been started, and 90s it was very peak level, and 2000 it was there, and it started to decline from 2017 when we are seeing 11, and still today up to date when we are seeing there is a prevalence rate has been more decreased. When we are seeing in India, it's like a more prevalence is Mizoram, the state which has a more HIV. It's due to a less awareness. Okay, as we know that, is it truth that, and we know that it will be transmitting during pregnancy, intranatal and postnatal. We can prevent, yes, if we think being a medical person we can prevent that transmitting. How we can prevent? By proper educating the maternal other, that is the mothers. We know that during pregnancy how it is transmitting. I will go to the next slide and then I will come back to that slide. See, when we are seeing in during pregnancy, in during pregnancy we know that when after fertilization, after zygote is formed, when it is started to attach into the uterus, that means the uterine wall, that intervillous space, that is maternal circulation, when it is started to enter, the trophoblast or a zygote which has a less immunity, or the cells are not good, when the chances of transmitting HIV from the maternal to fetus is more chances are there. And also in case mother is like a HIV positive and she is not taking ART drug, that is the antiretroviral therapies, and her CD4 cell count, that is the human cells, when it is the human cells are less, chances of transmitting is more. So risk of transmitting during a pregnancy inside the uterus also there is chances, that is at 5 to 10 percentage of rate of transmission is there. When we are seeing in intrapartum, especially intrapartum, it is a medical, being a medical persons, we are also responsible how to conduct the deliveries, and also what are the methods we can prevent a transmission is there. So when we are seeing in intrapartum, we will see the detail in next slides. And postpartum, same thing. Postpartum, every mothers and every medical persons, everyone, we all are having doubts that whether the mother during a postnatal transmission is possible. Yes, and we know that everyone, we are thinking it is 100% it will transmit. No, it is the mother's choice that whether she want to feed her baby, she can feed. If she is not willing, it's up to her choice. So when we are seeing in a postpartum period, that means they're telling many researches are ongoing. When we are seeing both side researches are going on that when a mother with HIV, when she feeds a baby, chances of transmitting infection can happen and cannot also, because they're telling how it can and how it cannot means when they're telling when it is the fluid holds the HIV, it can transmit. That means they're telling 16% are there. How it cannot? When we are seeing breast milk and this one which has a high antibodies, and when a mother is on a ART drugs, there is a less chance of transmitting. So always when we are coming into this controversy, it's up to the mother's choice. If she want to feed, she can feed. When we are seeing how the maternal transmission rate during a pregnancy, when we are seeing it 5 to 10% chances are there. During a labor and delivery, still 10 to 15%. Breastfeeding, we have a During breastfeeding, 5 to 20 percentage are there. Like overall, in case of mother is not at all feeding, 15 to 20 percentage are there. And in case mother is feeding up to 6 months also, 20 to 35 percentage. And overall with breastfeeding for 18 to 24 months, 30 to 45 percentage transmission is there. as we know as we know, when a mother is exposed with the hiv, it can be, we know that is I'm not going to talk more on mode of transmission, like we know that is multiple partners, prostitution, iv drugs sharing, everything which can cause a transmission. The window everything we know that it's a window period or incubation period is 1 to 4 weeks. My topic is PPT, that is a prevention of parent to child transmission. How we can prevent and how it is transmitting. As I told you all, vertical transmission, that is the like from maternal, that is a mother to child transmission. Excuse me. Transmission is about 14 to 25 percentage, and transplacental transmission 20 percentage before 36 weeks, and 80 percentage transmission around during labor. That means during pregnancy where there is a less chances comparing to during labor and delivery. So, what are the like a parent to child transmission of HIV? Vertical transmission is more in cases like a preterm baby. Why it is preterm babies or a preterm rupture of membranes or a prolonged rupture of membranes causes a more transmission. We know that when there is a mother has come to the labor and the membranes are ruptured and prolonged time has happened, chances of like a ascending infection which can enter into the amniotic fluid and which can enter into the fetus, more chances of vertical transmission can happen. And
Excuse
also
me,
which can be like a mother
ma'am.
is having.
Ma'am, sorry to interrupt. Ma'am, can you please put your slides in slideshow mode?
Ma'am, it's going on slideshow now, ma'am.
Slideshow. And downstairs you have an option. From zoom out, the next option is there, ma'am. One cup sort of thing is there, no? Down only, ma'am. Click to add notes. You will have downstairs only, where we can
Yes,
zoom.
ma'am, actually in present.
Yes.
My slides are not moving, ma'am.
No.
Now, ma'am?
Okay.
Okay. Now it's moving, ma'am.
Yes.
Okay. So, thank you, ma'am. As I told you all, like vertical transmission, we were talking, especially maternal viral load, we have to think. How we can maintain the maternal viral load? If you see a HIV positive mother, she knows better than general public how she has to take like a drugs and everything. If her viral load has been increased, chances of transmitting infection to, that means HIV to the baby is highly, and also her lifespan will be decreasing because of viral load. So maternal antiviral therapy, we will all will have a doubt that when we have to start a drugs, antiretroviral therapies or any drugs, that means HIV drugs, irrespectively, once the mother or a mother has been diagnosed during a pregnancy, during a intranatal, during postnatal, any period, as soon as possible, once she has been diagnosed with HIV, we have to start a ART drugs, that is the antiretroviral therapies, without wasting of time. So when we are starting this drugs as soon as possible, we can reduce the risk of transmission, that is a parent to child transmission, as soon as possible. So now when we are seeing in an antenatal period what counseling or what we have to do, and during intranatal what we have to do, we will see in a detail. During antenatal period, when a mother is coming, we have to advise her regarding safe sex counseling. In case her partner is positive, and we have to advise her regarding safe sex by using a family planning methods, condoms, everything. And also In case if she's positive, also still we have to educate her. And also when a mother is having a HIV positive, we can go for the repeat HIV testing in case of she is in a window period, that is an incubation period. When a mother is coming to the, as we know, we are working in a clinicals, we are working in a government, private, any institution or anywhere, hospitals. When a mother is coming, that is antenatal mother is coming to the hospital, first thing doctors will write her, as soon as the confirmation of pregnancy, they will write, go for a VDRL, syphilis, gonorrhea, and HIV testing. And our government has been launched NGO, that is a non-governmental organization, ICTC, that is integrated counseling testing centers. Integrated counseling testing centers, which is educating the mothers, any mother who has coming to the antenatal visit. First thing they will tell, go for a HIV testing. The mother, we are telling both the mother and also husband, both couples has to go for a HIV testing. It's a mandatory. So otherwise in case of mother is coming to the hospital, she's unbooked, or we want to check it, we also, as we know, we faced a pandemic, that is during COVID. We developed, there was a small antigen antibody kit has been developed, and we are checking fatafat fast. Same like that, we have a now kit is there, antigen antibody test kit is there, which we can do a prick, we can use a finger prick test. We can go for a kit test, which we can identify 18 to 90 days after exposure of HIV by mother. And when we are seeing an antibody test also, in case of mother or a person, when they're exposed, we can check it 23 to 90 days after exposure. This is the ma'am, okay ma'am, you're telling in a hospitals, when we are working in a hospitals, we can refer them for the ICTC centers. In case our nurses, our student nurses, our nurses, when they're working in a sub centers or a primary health centers, what they have to do? In case we will not have ICTC not connected with a sub centers, in that condition, when a mother is coming, we can have a first thing, we will give a counseling to the mother and to the husband both, to go for a HIV testing. If they're willing, we have to take a consent. Some will be having a refusal, but we have to ask them to go for it. We have to go for repeat counseling we can achieve by good talk and maintaining good relationship. So after repeat a counseling, we have to go for a HIV testing. If it is a negative, well and good, we can ask the mother, go for a regular ANC checkup. If it is in case of she is a positive, we have to refer her for the ICTC centers, that is integrated counseling testing centers for HIV. After referring them, they will go for they will collect a blood, like a 5 ml of blood, and they will go for a RPR, that is the confirmatory test they will do. And also one more thing, we know that when a mother or any person who is exposed with HIV, chances of getting opportunistic infections, we know that, because why they're getting is because their immunity level is getting lower and CD4 cell counts are getting lower. In these conditions, we have to check the mother for a syphilis and tuberculosis also. This can be done in a subcenter? Yes, we can do it. Subcenters, they are checking, we have to ask the mother for a syphilis, whether she has any excessive vaginal discharge, blisters, any abnormalities, we can ask. And also tuberculosis, we know what are the signs and symptoms. Accordingly, we have to ask the mother to go for an investigation, and we can give the treatment. So once all the infected HIV mother should be, there is no if you are having we know that we are having any diseases, we will be having symptomatic treatment, and also same time we will have a, for short lifetime we will have a medication. But in this, irrespectively, mother has to lifelong, she has to go for we may have a doubt after delivery she can discontinue. No, she has to go for the ART, regardless of anything, as per the WHO guideline. and baby should go for a antiretroviral therapy for 6 months, which has been given by WHO guidelines. And also, in postpartum, when we are seeing ART initiation, that means we have to give the child up to 6 months. 6 months, we have to give a ART drugs. We have to, in case if it is this one positive, we have to extend it. The baby, whoever is exposed with a mother, HIV positive mother, 6 months, it is a mandatory. Baby has to go for a ART drugs. I will tell the what are the drugs in next slides. So PPTC, that is a prevention of parent to child transmission regimen. When a mother a known of HIV case, we have to continue the ART drugs. Newly detected HIV mother means ICTC center counseling and CD4 cell count we will check, and we will start a ART. We will give up for the infant daily nevirapine, that is the syrup we will be giving. We may have a doubt when to start a nevirapine or lamivudine, zidovudine. There is a syrups are there according to the birth weight of the baby. We will be starting. That is also is there in the next slide. So before that, we have to check the CD4 cell count. This is the immunity cell count. If your mother is having CD4 cell count, we may have a doubt with like after checking CD4 cell count, mother is having 350, 500, more than 500, we can delay the treatment. No, we should not take in case of pregnancy or this one. No, not waiting for anything. We have to start a ART. But if you are seeing in a normal patients, they may check for the CD4 cell count and they may delay, but no delay for anyone. But we have to check the CD4 cell count. If it is less than 350 cells, that is, we have to go for a mother. That means person has to initiate the treatment. 350 to 500 recommended initiating therapy, and more than 500 considering initiating therapy. So, as I told you all, after mother has been positive, sir, first speaker was telling that many drugs are, he was telling. There is a kit is coming and it is free of cost. We have to give this drugs for the lifelong. That is a tenofovir 300 milligram, lamivudine 300 milligram, efavirenz 600 milligram. This will be given to the mother for the OD. Sometimes viral load is high, it may be changed. And when we are coming into the baby, that is the as soon as the baby has been born, irrespectively without checking baby baby is positive or negative. If you are checking also, it will give the negative. With that, we can't find whether the baby is negative. So as soon as the baby is born, we have to start a nevirapine syrup, zidovudine or lamivudine. Some hospitals are following a different protocols. I would like to say my personal experience that when I was working in outside in African countries, most of the many peoples have been affected with HIV. It is the reason because behind is they are having more sexual partners and also prostitution, and they knows they're not considering HIV as like a big disease, or because they're taking ART and they're living their life very peacefully and normally. So when we're seeing this one, baby has to get a nevirapine syrup for the 6 weeks to 12 weeks also we can give. So in case we are entering into the intranatal, when we are entering into the intranatal period, once like a mother has come to the labor room and she is unbooked, that means she never heard any reviews or any ANC checkup, and she has directly come to the labor room, means what we can do. And we know that as per the WHO guidelines, they're telling that treat all the patients or all the mothers as a infected or infection patient, because being a healthcare person, we are also chances of getting many infections, as we know HIV, hepatitis, and also many things are we are getting HV, SAG, many things. So to prevent this, when any mother comes in intranatal, we have to we have to check for the immediately with the kit, antigen antibody kit, we have to check for a prick test to identify whether she is a positive or negative. no problem, we can go for a normal delivery or a cesarean, whatever it may be, normal routine care. In case of she is a positive, send a collector blood and send for a CD4 cell count and start a next day itself. We have to start a refer, and the same day, not even next day, same day itself, we have to start a ART if she is a positive. And in case of, as I told you, baby ka already I explained. Okay, this is the being a nurses or a medical person. Here is a very crucial period or a crucial concern during a intranatal. In India, we are seeing any mother is positive means 99% all doctors are taking a cesarean. That is also elective cesareans we are doing it. There is no any standard protocol that if the mother is HIV positive, she has to go for a LSCS. There is no any standard protocol. She can go for a normal delivery, anything. It's a according to the maternal condition. So when a mother has come to the delivery, we have to use a universal precautions. We know that like a astronaut, we will be wearing all the personal protective equipment, double standard gloves and everything we will wear, and we will entering into the like a moon, like that we will go, because it may transmit to us. So universal precautions we have to use it. And also the main thing is, when we are in a labor room, we know that we used to do a ARM, that is the artificial rupture of membranes. When we are doing a artificial rupture of membranes, the progress of labor will be faster. But in this condition, HIV positive mother, we should not rupture the membranes, because when we are rupturing membranes, chances of ascending infection and more chances of transmitting. And as I'm telling you all, as much as possible, we can delay the like a rupture of membranes. Main thing is, we know that every like a 2 hours or 4 hours once, we used to do a per vaginal examination when a mother is in a labor room to assess the progress. But in this HIV case, we should avoid a PV per vaginal examinations. And also nowadays we are having a high techniques like a cord blood sampling collecting, we are doing a fetal blood sampling by the fetal electrodes. These are the things we are doing it. In this, when a mother is HIV positive, it's a totally contraindicated. We should not go for a like a fetal blood samplings in a this one, or and also we should avoid a instrumental delivery. We know that forceps, vacuum, many things are there. It should be avoided, because when we are giving a cut or a instrumental delivery, chances of rupturing blood vessels, and there is a contamination or a contact between the fetus and blood or secretions, so we have to avoid it. Next, when we are saying avoid a routine episiotomy, when we are giving episiotomy, same thing, blood and this one fluids can be come in contact with the baby. And main thing, we know that as soon as the delivery baby has come out, what we will do is take a suction. Fatafat, sister, Carlo, we are doing it. We should avoid a suctioning the newborn, and not only for the HIV baby. In case of, as per the pediatric guidelines, they're telling, in case of baby is having a secretions, baby is not crying, we have to go for a suctioning. Otherwise, we should not do any suctioning. And also in case of babies having a meconium stain, when we are doing a suctioning, we know that we are irritating, and also chances of ruptures or this one chances are there. No, pediatric guidelines are telling, when baby is having meconium stain or secretions, go for a suctioning. Otherwise, no need, just wipe it and continue the routine treatment. And in case of cesarean, in case of HIV mother is going for a cesarean section, we have to think same thing, in like a membrane should be left intact. And also we know that many researchers also telling that, and some researchers are contraindicating when we are having a prolonged cord like a cutting, or a should be clamped late, we are having. But in this condition, HIV, we have to go for early cord clamping. When we are doing early cord clamping, we can prevent blood transfusing from the maternal blood to the fetal blood. And also this is the not only for the by personally I'm telling, during a operating room when I was working also, many times we used to have a needle stick injuries and also needle pricks we don't know, mother is many times we don't know, sometimes electives sorry, emergency cesareans, emergency cases will come, we can't even know whether it's a positive or negative. In that conditions, usually surgeons should go for like a more precautions, using a round body needles, using a proper instruments, everything should be utilized. Because when you're using a like a cutting or reverse cutting needles, chances of getting a needle prick or needle stick injuries needle injuries are very common. And being a nurses, we what we will do, if you are getting a prick, immediately remove the gloves, and we will clean with this antiseptic, and then once again we will put a gloves and we will continue the surgeries. But we should not do that. First we have to protect ourselves, then only we can care others. And one more thing, we are getting paid by whomever, it is a private or government. First, if you are healthy only, money is secondary. So please, being a healthcare workers, don't negligence is very common. Even I also done that. We should not do that. When we are getting any needle stick injury or suture needle stick prick or something, immediately inform to the infection control nurse, and yeah, like take a safety precautions, like a post needle stick injury prophylaxis, everything we can start. And also, as I told you, these all are things main. And also we when we are thinking, we are a medical persons, we are having we have a knowledge, and we know how to protect ourselves. When a biomedical it's when it is coming into the point of biomedical waste, we know how to segregate. And when a person who is coming to take the biomedical waste, we have to tell him this is when we are giving, this is a HIV positive mother, and especially placenta or a blood or any like a tissues, it should be separately separated, like a red cover me we have to put, and we have to give it to the biomedical person, and we have to tell him also. This is already I told you all. In case of like a infant has been born with a HIV mother, we will be starting a nevirapine, that is a nevirapine zidovudin, we will be starting as soon as possible. And one more thing, we will be having doubt whether we can put the baby in a mother's breast for a milk. 100% we can put, with the mother's consent, and mother should accept, and mother's willingness is very important. If she want to feed her baby, put a baby in a breast milk and as soon as possible. And provide a nevirapine, that is antiretroviral therapies prophylaxis, according to the birth weight, 200 grams or less than that or something, 5 milligram per dose twice daily we can give. And if it is like a 2500 grams or above or something, we can go for 10 to 15 milligram per dose twice a daily we can give. This should be given for a 6 weeks. The main thing is, when we are coming into the breastfeeding, as soon as birth we can start the breastfeeding. After starting, that means as per the mother willingness, it should not be have a mixed feeding. Like a breastfeeding, we are having like a normal people, they will go for a breastfeeding also and mixed feeding also, that is a replacement feed also, both they will have a mixed. But in a HIV mother, there should not be any mixed feeding. Only if she is willing, she has to go for exclusive breastfeeding for 6 months. If she is not willing, she has to go for a exclusive replacement feeding, no mixed feeding. In this condition, as I told you, all mother will take the ART throughout her life. And infant, what we have to do, we have to give a syrup for a 6 weeks. After 6 weeks, we can like start a CPT, that is a trimoxole, that is a prophylactic treatment which helps to prevent, it is antimicrobial in case of chances of getting infection, so we can start that also. And we can start a immunization, first dose of DPT OPV we can start. And early infant diagnosis, we can go for like a after 6 weeks, it can be a WB, that means WBS means wed wet blood sampling or a DBS, that is a dried blood sampling, any one thing we can collect, and we can check for whether the baby is having HIV positive or negative. So after birth, we cannot tell babies are positive or negative. After 6 weeks, we can check that means wet blood test or a dry blood test. And also we have to check the CD4 cell count. And main thing is there is no mixed feeding during when a mother is having exclusive breastfeeding. Same thing here, when a baby is having like a replacement feeding, mother will be having a same ART drugs. Here also baby will be taking a prophylaxis for 6 weeks. After that, we can start a CPT, that is a cotrimoxazole for antimicrobial therapy, immunization. Everything will be same for both the babies. Only thing is when we are educating the mother, if she's willing, go for a full exclusive breastfeeding or replacement feeding. What are the advice we have to give for the mother when she is getting discharged from the hospital? We know that she may have doubt that my delivery is completed, can I discontinue? No, she has to continue her ART throughout her life. Otherwise she will be getting opportunistic infection, and also she will be more like this is not a treatment, this is just we are prolonging her life. The ART drug will reduce the HIV transmission through the breast milk during breastfeeding. And also when we are seeing it, the main thing is after delivery we have to educate the mother, like a family planning. We can advise her go for a temporary or a permanent according to the willing of the mother. Especially we have to educate her regarding like a spacing methods, condom usage, copper T, and also immediate postpartum copper T is also we can advise her. Arrange the mother for an ERT to be followed with the ERT centers. We have to connect her. And we know that the confirmatory test after 6 weeks, the child we have to do, we have to ask the mother to come with the baby after 6 weeks. That is a quantitative RNA assay. Otherwise, they will tell PCR test, polymerase chain reaction test, that is will be HIV DNA test we will be doing and confirming the baby whether baby is a positive or negative. The main thing is like if the mother is coming from like a village side, we cannot follow up her most of the time. And one more thing, if you are seeing many people like a pregnant or intranatal, that means mothers who is a street like a street left in a street, or who is a beggars or like a prostitutes, they are the one mostly they're affected because of less knowledge. In these conditions we cannot like reach them in the areas. In these conditions we have to educate the ASHA workers, ANMs, counselors regarding follow-up of the mother and also baby. Like after discharge, follow up the baby and whether the baby is taking proper nevirapine prophylaxis and also feeding, general counseling, everything we have to attach ANMs and ASHA workers with the HIV mother. This is the main thing is, now we talked about mostly during antenatal, intranatal, postnatal, how it is transmitting everything. When we are coming into the prevention of HIV among healthcare workers, we know that prevention is better than cure. Like we have to use I told I am also best example. When I worked in clinicals, we will not have a time to think, we will not have we will not use a proper standard precautions, PPEs. When we exposed or when we are getting, then only we will. So being a young nurses, everyone, I'm telling that please always use a standard precautions to protect ourselves. When we are healthy, we can take care of others. And also in case something has happened, we have to inform to the infection control nurse and take a proper post exposure prophylaxis. And also hospital infection control we have to maintain. So this is the last question answer session. Confirmatory test for the baby born with a HIV positive mother. What are the HIV test and the drug of choice for the baby exposed with HIV positive? The participant, you can put this in the chat box. What is the answer? I think I'm end of my session.
Yes, ma'am. Ma'am, you can display the. Yes.
Ma'am. Yes, ma'am. Please.
Ma'am, meanwhile, they'll put the answers. We'll just answer few questions which has
Yes.
been put in the chat box, ma'am. This you have discussed, but still, how to conduct delivery in HIV positive patient?
Yes, ma'am. Okay. So when we are seeing HIV positive mother, I told you all it is not a standard protocol that she has to go for cesarean or nothing. We can conduct a normal deliveries. Only in, especially if you are seeing in India, we are having like a more social stigma, and also HIV positive mother means we are away from her. Nothing. We should not maintain like that. Use a proper personal protective equipments, and she can go for a normal delivery. That is also like no madam, I want like she is telling nai, I want to go for a cesarean because a normal delivery chances of transmitting like a baby infection, we can give a choice for her. And one more thing, it is not a indication of getting like a cesarean because of HIV. She can go for normal or cesarean. It's up to the doctors and maternal condition and mother's willingness. We can conduct.
Yeah. And we have one more question. So, as a nurse, what recommendations can be given for a midwife regarding the challenges that an HIV patient or an AIDS pregnant woman is encountering during her prenatal period in the present day health center and hospital? Present day scenario.
I'm once again I'm reading the as a nurse. Acha, ठीक है. So when we are as I told you all, as a for a midwife, what advice I would like, not only me, this one is many times like when a midwife receives HIV patient or HIV mother, first of all, we should not like expose her personal things. We know confidentiality is main thing. Second thing, and even though we are maintaining confidentiality, we have to inform her condition to the healthcare workers, because when we are informing only they knows. During a changeover, like during a shift time, we have to tell that this mother is like we used to stick this one, but with this we should not propaganda, or we should not stigma. I say we should not do. Second thing, being a midwife, what I'm telling is, these are the challenges. We should not like because of this I will not conduct delivery, I will not give her antenatal care. Nothing is like that. We know that is how it is transmitting, and how we can protect ourselves also we know. So and many research, I'm also wonder that many researchers telling that once the HIV organism is exposed to the environment, immediately it will die. We are thinking even the secretions which is present in the environment which can transmit, but once the HIV organisms comes out from like a body, even though fluid is there, it is environment, it cannot survive. Many researchers telling, controversy is going on. So being a midwife, so what I am advice is giving when antenatal or intranatal comes, no need to worry. Same like other mothers, we can give a care, only protect ourselves and also protect the mother.
Yeah, okay. Ma'am, one more thing, ma'am, if the baby is delivered through normal delivery and if any more secretions are there, so what we have to do according to the new guideline, because you have mentioned don't do the suction.
Okay, thank you. So as I told you all, like we should not do suctioning. When a baby is having a meconium or any secretions, we can go off, but we should not go for a vigorous suctioning. Like if you're seeing like we are using electrical suctioning or something, the pressure is high. That is why in we know that is a different types of suctionings are there. In if you're seeing in a normal delivery rooms, they will not use any electrical suctioning. They will be using always bulb sucker or like a mucus sucker, so which gives a less pressure. So we can go for a bulb sucker if the baby is having a more secretions, or a baby is exposed to with a like a this one a meconium or anything. We can go.
Okay. Okay, ma'am. So thank you very much for the session. No more questions are there, I guess. Any questions are left, you can ask in the chat box. And one comment is there, PCR. If you can explain polymerase chain reaction. PCR is there.
Uh,
So you can just
PCR is the like a polymerase chain reaction test, which is done after 6 weeks of this one. Because when a baby is exposed with a positive HIV positive mother, immediately we can't tell whether she is a positive baby is positive or negative. So after 6 months, when the baby is coming with prophylaxis taken, we have to go for a PCR. That is the test polymerase chains. We know that the HIV binds in the proteins and proteins. That is why PCR is polymerase chain reactions. That is chain how it has bind. That is the one thing PCR test we will give the correct results.
Thank you so much, ma'am, for a very informative session. So we are almost to the end of our session, and I cannot end this session without a word of gratitude. I am Lindsay Abraham, Assistant Professor from Panna Subharti Nursing College. I am having this opportunity to deliver the vote of thanks. So I'm very much privileged in thanking all the three speakers, Mr. Hariharan Shankaraj sir, Professor Anand Sam sir, and Professor Infant Rani ma'am. They have informed us according to the theme of this year, which was given by WHO, having the mission to completely get rid of AIDS by 2020-30. So the instances which already have been taking place in healthcare and what all can be done in future to prevent. So all these things have been very much broadly and briefly discussed by all the three speakers in a very explanatory manner. I am very much thankful for to all the three speakers to who have being in their busy schedule have taken time for this webinar. Thank you so much. And I cannot complete my responsibility. It will be incomplete if I am not mentioning our principal ma'am, Dr. Geeta Parvanda ma'am, who is the principal as well as the UP chapter president of ANI. So I'm thankful, ma'am, for giving us all the support and guidance to conduct this webinar in a successful manner. And I'm also thankful to the ANI president, Captain Achita Nair ma'am, and also the founder member, Mrs. Tangam Gomez ma'am, for their constant support and encouragement which they have given us. And I am thanking and I'm very much thankful to all the audience who have participated in this webinar and also have put on their queries as well as their comments regarding this webinar. I've actively participated from the starting of the webinar till now. So hoping the information which has been shared through this webinar is useful to all of us. And that's all. Thank you so much, everyone. Thank you.
Excuse me.
Yes.
I would like to thank Professor Dr. Geeta Parvanda ma'am, and ma'am, in near future, if you're organizing conferences or webinars, we are most willing to give our sessions, and we are ready to participate in anything, ma'am. Thank you, ma'am.
Sure.
Thank you so much, everyone, and being a part of this training session webinar. And I'm looking forward to have more session in future.
Sure, sir. Thank you. Thank you.
Thank you.
Okay, sir.